Well, good afternoon, and thank you for assisting to this session this afternoon, and thank you for the introduction. So today I wanted to discuss some issues about the involvement of people with dementia and their caregivers in the development of assistive technology solutions using this living lab approach. And so the points that I will briefly address in this presentation. Okay. It's okay, it's very. So the points that I will address in this presentation are a brief reminder of some assistive technology products that are currently used for dementia care. Then I will discuss about two approaches that are commonly used to design and to evaluate these products or services. Then I will give some characteristics of this living lab approach, and I will illustrate it with some of the examples of projects that we are currently conducting at our living lab. And then I will finish with a short discussion on advantages, limitations, and challenges related to the use of this living lab approach for the assistive technology design. So it's, I think everybody here in the room has already seen or heard about assistive products to support people with cognitive impairment and other carers in everyday life. These can include special communication devices, software application for stimulation or for task guidance, medication reminders. We have also these social robots that are very popular right now in these days. We have also these smart home applications and also smartphone applications for caregivers. And then we have also these kind of wearable cameras that allow the person to collect the daily experiences through photographies. So how we design, how we conceive, and how we evaluate these products. Basically, there are many approaches, but I will just describe two of them that are rather opposite. The first one is product-centered design. So this is a conventional design approach in which the manufacturer or the designer has a very precise idea of what he or she wants to develop. So this product, its features, functionalities, and uses will reflect mainly the perspective of designers or manufacturers. So we can imagine that this kind of approach, there is a little user involvement. The advantage is that the process can be fast and less expensive than other more participative approaches. But there are many limitations. For example, in this approach, users have to adapt to the product and not the other way around. And it can be very reductionist. For example, when designing for an older person with dementia, the designer using this approach can identify two key features, for example, memory loss and age-related changes, and then he will use only these two factors to design a product. Whether I will show you the difference using this other approach that is called user-centered design. So the name says it, the user here is placed at the center of the design process. And so when we use this approach for designing for dementia, assistive technology for dementia care, we have not only the dementia symptoms, but we have to take in consideration a number of factors related to the person, to the context, to other health issues. So we'll have like a bigger picture of the situation of the person, and this will help us to develop products that will really meet the user's needs. So in this approach, the assistive device is not considered as the solution, but rather as a part of this global solution, which normally combines other components like personal care, psychosocial interventions, environmental modifications. So this is a way of conceiving technology not only for the product itself, but how it is going to be really used in the real life. So in this way of thinking, we have not only all these factors that we have to take in consideration, but also the stakeholders. When we design using these user-centered approaches, we start seeing like there are other actors on the system, and they have interest on this solution. They are concerned by the situation, not only the patient and the family, but this can be other stakeholders like researchers, ethics committees, the providers of assistive technology, policymakers, business partners. So basically, the Living Lab approach, what proposed is what suggests is that we have to take in consideration both micro-level factors related to the users, but also this whole stakeholder network. So the Living Lab acts like a mediator between these micro-level and micro-level factors, and it can act at any moment of the design or development process, from the assessment of needs to the provision of assistive technology solutions. So McAfee and colleagues have given a very interesting definition of Living Lab, and they say that these Living Lab are physical regions or virtual realities in which stakeholders from public, private, people partnerships, they get together to collaborate to create, prototype, validate, and test new technologies or services or products in real-life context. So now in Europe, we have a network of European Living Labs that is called INOL. And we can see these living labs are working in many fields, but there is an increasing number of living labs working in healthcare, like using these approaches. And I'm going to give you another example. It's a project called Innovate Dementia, which reunites organizations from the Netherlands, Belgium, United Kingdom, and Germany to promote the innovative care for people with dementia using this approach. So the involvement of people with dementia in technology projects has received increased attention over the last years. And for example, Span and colleagues have published a literature review in 2013. And they have studied 26 cases of projects in which the researchers worked with people with dementia. So they analyzed different phases of the design project: explorative, technical development, adaptation, and the evolution of the solution. And they conclude that there are 3 ways of involving end users. Like the first one, the basic one, is like consider them like an object of study. So in this approach, researchers observe people with dementia and learn from it, but they don't little interaction. In the second one, they are considered like subjects of study, so there is more collaboration, but more like information, like ways of getting information through interviews or things like this. And the third one is like really considering the person with dementia as a co-designer and a partner in this project. And in this review, they found that only 2 projects really considered people with dementia as partners. So in the Living Lab that I work in Paris, we've been working since 2005, and we have worked in many areas, different areas of assistive technology, from telehealth, robotics, e-learning programs. And then these are some statistics. In this period, we have involved like more than 1,500 people, either people with dementia, but also formal and informal caregivers, and this in 26 projects. And we have experienced like an evolution in the work we conduct at the Living Lab, because in the first projects, we had adopted like a really more traditional perspective, research perspective. So we try to understand how people use devices from a cognitive psychology perspective. Usability studies: is the device adapted? How can we change it? How can we improve performance? But then, with the years, we start getting a larger perspective on this issue, and we become more interested in studying the adoption of assistive technology in real life. And we can see that there is this difference between research and the real use we made of these devices, and how can we really empower people by using assistive technology, and which is the role, who are the actors involved, the stakeholders. And so we are now working also not only in assistive technology development, but in this concept of social innovation through the Living Lab activities. So I would say that in our activities, we have followed these stages, like working with people like an object of study, then like subjects of study, and now in our projects as partners. So I will finish with three ways of, three activities that we are conducting right now. And the first one are collaborative workshops. So in these kind of meetings, we reunite, we get together different stakeholders, so people with dementia, families, social care professionals, health professionals. They get together around a topic, a subject. In this case, it was the development of an assistive robot. And it's a really interesting setting because everybody, we give like equal importance to the views of of every stakeholder. So before, for giving you an idea, before we invited and we made the focus group exclusively with people with dementia, and now we're trying this other modality in which everybody, all the stakeholders are together, and it has shown to be very, very productive and very interesting, and we really feel an environment of co-conception of the solutions. The second one is the Multimedia Cafe. So this is an activity we're conducting twice a month, in which, in two phases. In the first phase, we have trained older adults on the use of assistive technology applications for social support. These persons were caregivers, widows, isolated people, not people with cognitive impairment. And then in the second phase of the project, these trained older adults became group activity leaders for the training of new participants. And in the second group, there were people with cognitive impairment or frailty. So it's been a very interesting project because we work with two different populations, and each one really like adopts a particular role. And the activity, now we are only like doing administrative stuff because people are dealing with it almost by themselves. So we are going to see if then we can make a third phase of this project, like creating a group of activity leaders of people with cognitive impairment. And the last one is the L'Usage Open Days. We've called that like this. Our living lab is in a hospital. So once in 2 months or 3 months, we're doing these activities that giving free access to people on a Saturday, and open the technology laboratory, so families who come to visit the patients at the hospital can come and see the technological products. Researchers are there, so we can ask questions, conduct surveys, and discuss with people. And it has proven really interesting for generating new ideas, for assessing acceptability of technological solutions, and so on. So challenges ahead. So we have tried like the two ways, like doing very classical research on assistive technology and usability, acceptability, and these more open and flexible approaches that the Living Lab allows. We can confirm that the involvement of persons with dementia in research leads to better applications. But there are some limitations. So it's like being less scientific, replicability is difficult. The recruitment sometimes is difficult, and we need more flexible methods for gathering data in these real-life conditions. So, and then is the big question of how, which framework for legal and ethical aspects in this context, when we consider that the person with dementia is a partner of the project, so it's not longer a participant, a subject, but a real partner. So which role and with retribution can we give? So thank you very much. Okay.